Okay, just to let you know, I'm recording this session so that we can give it to the volunteers if they weren't able to make it today.
Okay.
So I'm not going to be clicking on the patients tab because I don't want any of the patients' names to come up in the recorded session. I've already opened up this practice patient profile that we have, which is test. Anytime you guys want to practice anything, I highly encourage that you use this profile. So I'm just going to give the new managers a basic preview of like TPC, which hopefully by now most of you guys have some sort of idea of how it works and what we're using it for. So up here are your main tabs on TPC. Your dashboard gives us like a summary of everything that we do in the clinic in terms of ordering medications and all of that. So far, it's slowly being updated, so it's not 100% representative of all the meds that have been ordered in the past couple of months. But I think by next year, it should be very clear in terms of how much we're doing through the patient assistant program. And then, as you guys have seen, this is the main patients tab that will allow you to search for a patient, to get their profile summary, their meds, the requests, and we're going to go over all of those in detail, the history and notes, and the messages. The care providers right here allows us to input any information regarding our physicians who prescribe for the patients. And as you guys have seen, we just have a couple of physicians that we order the patient assistant program medications through. This is where we would put their DEA number, the expiration date, which is all pertinent when ordering medications through the patient assistant program. This main messages tab is different than this little messages tab. So this one will give you all the messages, all the history for all patients, no matter what clinic they're at. Versus this messages tab, because I have opened this patient profile, it's going to be specific to this particular patient. In our case, that person is test. And then the reports, again, it'll give you a summary of all the things that we're doing in the clinic. We'll go over that later. Research, I'll also go over all the things that you can do in terms of finding out if a particular medication is offered, what the requirements are from manufacturers. And then center administration, I'll also show you some things that we do use over here. Let's start off with our patient. So we have a patient that we've added their profile into TPC. Chart number for test. What we want to start doing is we want to make sure every patient is matched with the most common clinic they go to. So if they go to Pacific Beach a lot, then we'll put PB here. If they go to downtown, be it Monday or Fridays, we're doing essentially the same for both. We're just putting DT, etc. The patient ID is specific to each patient. We don't really fill this part out. I'll show you guys what other IDs we are going to fill out for each patient. This is their primary care provider. This allows us to put in what provider is the most, essentially is the most common one that we order medications through. So for instance, in downtown, it's oftentimes through Dr. Michelle Johnson. So instead of having to fill it out later, which I'll show you when we're ordering medications, if you put their primary care provider as Dr. Johnson, later on it'll automatically populate when ordering medications as Dr. Johnson for their primary care provider. Demographics, most of the patients don't have a social security number, so we leave it as NA. You do want to put their first name, last name, middle initial if they have, or middle name, their gender, anything essentially that's highlighted in pink, and anything that's starred. So you have to put their date of birth, their ethnicity, marital status, number and household. Now, much of this information we can get through Epic, and I'm so sorry, you guys. I know we've had such a delay that was unexpected in getting Epic access. We are still working on it, so I will let you guys know when that happens. Citizenship, that is also required for some of the applications. Contact information, you always want to fill in the address, the city, county, state, etc. Their phone number, you want to make sure it's up to date, because later on in our program, we do want the ability to be able to call the patients in case we need them to come in to sign paperwork or to update any information. And then also for the finance part, we do want to start putting these in. So a lot of some of the manufacturers, like GlaxoSmithKline, are now requiring that we get the income information for the patients in order to make sure that they qualify for their program. So when you do want to add it, add an income essentially, you are going to be clicking on this button right here, this is for other people in the person's income. Let me see, edit, contributor, yes. Okay, so here we have it where the person this is their own income. If they are the sole income or one of the people that provides an income for the family, you're gonna click on this, you're gonna put edit contributor, make sure it says self, update. Oh wait, no, hold on. Sorry, 1 second. I believe there was another one. Oh, here we go. This is where you add the person's income. If it's their own self, you're gonna put in the exact amount essentially, and it'll update it. That way it'll automatically populate whenever you fill out a form. No need to fill out the verification or the insurance. Medicare Part D, only if they're above a certain age, and it will trigger a note if it doesn't let you go through, and based off the person's birthday, telling you make sure you put in their Medicare Part D status. And obviously for almost every single one of our patients, it's always no, just because they don't have any insurance. Vaccinations, we do want to start putting this in. So with their pneumococcal, tetanus, influenza, if we're able to get that information, let's make sure we do update it. We've also allowed the Pneumovax clinic access to the pharmacy connection so that they are able to populate this as well. But if you know and you see it in Epic that they got their pneumococcal vaccine, for instance, make sure you are filling this information in. Okay, and then I want to take you guys over to the action menu on the right. This is something that we are going to be using. For instance, if we want to make a note about the patient and we want this note to be seen right when you open up the patient's profile. So I'm going to make this a test note. I'm going to make it urgent test. So now when I go to the patient's profile, it'll automatically come up over here. It'll show this pink red bar showing me that I have a message for this patient. And I know it works because Downtown had been using it, and I was able to see it when I was at Baker Clinic that we have a particular issue for this patient. So you do want to make sure you're using this feature as much as possible if we do need to communicate with each other, or if you want to put in a reminder for yourself for the following week.
I was like, I have this online training meeting thing, so I gotta go early. She's like, okay. I'm like, okay.
Can you guys mute yourself? So
I'm listening to it right now, but if I missed it, like,
can you guys? Hello? Can you guys all mute yourself? Make sure you're muted because we can hear you. Okay. Let's see. Okay, this is another really important part in the action menu, managing PAP IDs. So this is important for some of the programs like GSK or others that will require you to put in a patient ID when you're reordering. So let's say I have a patient's GSK information. I put in their ID. I put in when their re-enrollment date is. This is really important so that we can make sure we are writing up a new application for the patient if their re-enrollment is expiring. You'll press save and it'll populate over here. And you can put in multiple ones. So over here we've already practiced putting in GSK, here's patient's ID, their re-enrollment date for Johnson & Johnson, etc. And you can do as many as you want based off of the programs that give the patient ID. All right, and now for attaching a document. So we are going to be bringing in scanners. Dr. Frykowski has approved that we buy scanners for each clinic, and these scanners will allow us to hopefully quickly scan in any sort of documentation that we have for the patient. That way we are avoiding having to lose any paperwork, or whenever we get physician signatures or even the patient's signatures, we can upload it onto here. So here we have an example where we put income verification, prescription, and then etc. So we'll give you guys exact directions of what types of descriptions that we want for each type of document. So make sure you guys know to go over here to scan up a paper or any pages. Another important feature on the action menu is the ability to inactivate a patient. So if a patient is no longer coming to the clinic, you can definitely come over here and inactivate them. The nice thing about TPC is that later on, if after a year or so they decide they want to re-enroll in the clinic, you can go ahead and come back and reactivate the patient. Okay, so that was all under the profile. Now for the medications. This gives us the patient medication formulary. So this is all the medications the patient is on. If we don't find one, or if the medical student is trying to add a new medication, we can go ahead and press add new. Whoever has their microphone on, can you guys please mute it just so that we're not hearing the different sounds in the background? So what you're going to do is you're going to search for the medication name. Let's say we want to do Flonase. You're going to click on that and add it to their formulary. That way you can go ahead and order the medication for the patient. So over here, see how it automatically populated Michelle Johnson because I put their primary care provider as Michelle Johnson. If it's not the case, if you do want to give like a different provider name, you can go ahead and select it. For their SIG, so this is going to say, okay, like how many times or how much of it are they going to be taking? Is it like 1 puff a day? Is it 2 puffs a day? For frequency, this will allow you to fill if it's BID, so twice a day, once a month, etc. And then you're going to go ahead and press save, and that will bring you back to the medication formulary where you'll find the medication over here. These are other information over here, the patient supply formulary. So this is things that we're not necessarily ordering, so you don't really have to put in this information. This is just optional. Let's say we do want to order a medication. So we're still under the medication formulary here. We're going to go, let's say we want to do Advair Discus. You always have to select the medication that you want to start ordering for. You're going to press check eligibility. This will tell us which programs are offered. It's always going to be the patient assistance program. And if you're unsure, please make sure you're asking the volunteers. They know their stuff very well, or if nobody knows, then definitely you can reach out to any of the other old managers or the managers that have been working on this for about a year. They'll be able to help you. So this whole eligibility, it's not always accurate. Oftentimes you will get that the patient is ineligible just for different reasons. It'll show you why they like fail to meet the eligibility, like over here it says program medication has an active request, you can still go ahead and bypass this. You don't have to necessarily go ahead and listen to whether they're ineligible or eligible. Just make sure you have all the necessary information. Then you're going to press start request. This will tell me why it's ineligible. I'm just going to bypass it. I'll say yes, I still want to go ahead. Now, I mentioned this in a previous email that I sent to you guys last week. Unfortunately, some patients have been receiving their medications at home, and that may be because the ship to address was put as patient. This is absolutely something that we have to be extra careful with. It can't happen because the patient, remember, if they're getting the medication at home, they're not going to be counseled on that medication, or they won't know how to use it possibly. So it's very important that we're careful when we're filling this out and we make sure that it says center right here. I've changed the settings so that it automatically populates as center, but I still recommend that we all double check before hitting next. You don't need to put any sort of diagnosis for this. You're going to put start request. So anytime you see these tabs, they're just meant to simplify our life. Like, let's say we needed to get a hold of the patient, like we work in the day, for whatever reason, it gives us their information, their home phone, date of birth, etc. Over here, it'll give us any sort of notes. This will give us information about the program, the patient assistance program. Let's say we needed to call them to reorder, or we just needed to find out information, whether it's about requirements, if this is during the day, during their business hours. This gives us all of our information. And then over here, it tells us how many meds we can order through them. And over here is where we fill out what form, or we select what form that we need to use in order to order the medication. So I'm going to select the proper form, which is the patient assistance program. I'll select generate form, and it'll download a PDF file with all the information automatically populated. Now, it's really important that when we get this form, when you print it out, do not hand it to the medical student and ask them to go get the signatures. It's so important that we go ourselves and get the signatures from the patient. And when you go and get the signatures, you want to go over every line with the patient. Can you verify that your name is written correctly? Verify this information is correctly. Is your mailing address correct, etc. Even how many people are in your household, because sometimes that information that we populated in TPC can be incorrect. Also, their income, you want to make sure that is accurate. If they tell you any of this information is inaccurate and you have to edit things, make sure you're going back to their profile and editing the information. And then any allergies, etc. This is where you're going to be filling out. So their prescription coverage, oftentimes, it's no, they don't have any insurance, no Medicare Part D, etc.